So diabetes tends to be one of those progressive disorders. Many people will progress to needing insulin, but what is important to remember about type 2 diabetes is not that you have cells in your pancreas that don't make insulin, it's that your cells are resistant to the insulin that your body produces. So you have some, it just is not getting to the site where it has to bind to do its active work. So many people become type 2 diabetic because of either family history or their weight or their lifestyle. So there are many things that one can do to mitigate the need for insulin. Lifestyle adjustment, weight loss, diet control. But even with that, with age comes insulin resistance, and if you're already type 2 diabetic, many people, even with good control, will eventually need insulin, but not everybody. So you've probably heard that liquor really has 0 calories, and that is a truism. The majority of liquor is metabolized by the liver, whereas other foods that have fiber and protein and carbohydrate and fat are metabolized not only through the liver but through the gut. So empty calories associated with liquor, yes, that is a truism, but it doesn't contribute to any weight loss. It actually contributes to weight gain because the majority of the breakdown product from alcohol gets turned into fat. So you don't get any nutritional benefit from alcohol. It certainly can relax us, but it is the kind of substance that does nothing to contribute to weight loss, even in the setting of 0 calories. Okay, so while I'm not a rheumatologist, I think the logical takeaway from this is that natural foods, foods without preservatives, really are good in any health setting. So good health, bad health, eating naturally is a better way to go. There is some data that's coming out that is suggesting that eating a natural vegan diet is a healthier way to go for those that have connective tissue diseases or autoimmune disorders, but as of now it's not. If you eat a natural diet, your lupus will be controlled. So certainly there are genetic conditions that make the blood more coagulable or thick. And so those conditions will predispose someone to cerebrovascular disorders, as well as hypertension, diabetes, dyslipidemia, which is cholesterol elevation. They can run in families, and so there is a genetic predisposition to those, and hence if they're not controlled, will contribute to stroke disorders. There are also some disorders whereby some people will have what's called AVMs, arteriovenous malformations, and these can be hereditary. These can burst in the brain and lead to a stroke. They're not common, but as far as a genetic predisposition, there are those conditions that can lead one if there's a family history towards stroke diseases, but the majority of people that have a stroke don't have that genetic predisposition. So asthmatics run the gamut from child onset, which tends to result in those children outgrowing it, or adult onset, which tends to be more chronic. So we do know that albuterol, also known as Ventolin or Proventil or ProAir, is the rescue inhaler. So if you're finding that you're using that rescue inhaler more frequently, you probably need to be on maintenance therapy. So maintenance therapy consists of typically a steroid inhaler, which is anti-inflammatory because asthma is really mitigated by inflammation in the airway, in the walls of the bronchioles, which are the small airways in the lung. So chronic asthmatics tend to use inhaled steroids, which at the dosages and the concentrations that we prescribe them don't have any of the same impact on the body as oral prednisone or steroids. So typically Maintenance therapy is with steroids and sometimes a bronchodilator like albuterol, but there's longer acting ones that we would tend to combine with the steroids for maintenance therapy, and you'd still use your albuterol for rescue.